Hello, my name is Dr. Junaid Patel from the online surgery, and today I'm going to talk about a very important yet common problem affecting many men, and that is erectile dysfunction. So, what is erectile dysfunction? Well, erectile dysfunction is the inability to get and maintain an erection. Approximately 50% of all men between the ages of 40 and 70 will have erectile dysfunction to some degree. It can have many causes, thus it is important to identify and treat any underlying conditions. Now, let's briefly talk about how an erection happens. When a man becomes sexually aroused, his brain sends signals to the nerves in his penis. These nerves increase the blood flow to the penis, causing the penis to harden. Now, anything that disrupts or interferes with the nerves or blood circulation can lead to erectile dysfunction. Furthermore, anything that affects the level of sexual desire can also trigger erectile dysfunction, because a reduced sexual desire makes it more difficult for the brain to trigger an erection. Psychological conditions such as anxiety and depression can reduce sexual desire. Now, there are a number of causes for both, there are a number of both physical and psychological causes for erectile dysfunction. Let's talk about some of the physical causes. Now, injury or surgery to the penis, pelvis or surrounding areas is a common cause for erectile dysfunction. Atherosclerosis, which is hardening of the arteries, high blood pressure, and diabetes all contribute or lead directly to erectile dysfunction. Diabetes is a condition caused by high blood sugar levels. This can affect both the blood supply and the nerves in your penis. Multiple sclerosis, which is a condition that affects the body's actions, including movements and balance, as well as Parkinson's disease, which is a condition that affects the way the brain coordinates body movements, including walking, talking, and writing. Both these conditions can lead to erectile dysfunction. Any disorder or injury to the spine, again, can cause erectile dysfunction. Now, there are also many other causes of physical causes of erectile dysfunction, but I'm just going to move on very briefly to some of the psychological causes. So the obvious one is depression, anxiety and stress, and factors which contribute to depression, anxiety and stress include relationship issues, finance, past sexual problems, and these can all lead to stress, low mood, anxiety, which in turn can cause erectile dysfunction. There are certain medications which can contribute or lead to erectile dysfunction. These include medications for high blood pressure, such as beta blockers and diuretics. Also medications for schizophrenia, such as antipsychotics. And also medication for depression, epilepsy and chemotherapy are known to cause erectile dysfunction. Some of the other more generalized causes include excess alcohol intake, tiredness, and using illegal drugs such as cannabis, heroin, or cocaine. Now, I'm very briefly going to talk about the treatment of erectile dysfunction. Now, if erectile dysfunction is caused by an underlying health condition such as heart disease, high blood pressure, or diabetes, then these conditions need to be treated first, as in many cases, treating the underlying condition can resolve the problem. If you are taking medication that can cause erectile dysfunction, there may be an alternative. It is important not to stop your medication without consultation with your GP or another qualified healthcare professional responsible for your care. Lifestyle changes. So, erectile dysfunction can be improved by making changes to your lifestyle, such as losing weight if you are overweight, smoking cessation, reducing alcohol intake, avoiding illegal drugs, regular exercise, and activities to reduce stress levels. So these kind of simple measures that can be done at home can help with erectile dysfunction. Now let's look at kind of commonly used medications used to treat or manage erectile dysfunction. The well-known ones are the phosphodiesterase 5 inhibitors, which are the most commonly used and effective type of medication to treat erectile dysfunction. These work by temporarily increasing the blood flow to your penis. The commonly used medication in this group are sildenafil, also known as Viagra, tadalafil, also known as Cialis, and vardenafil, also known as Levitra. Sildenafil and vardenafil work for up to 8 hours and are designed to work on demand. Tadalafil, which known as Cialis, lasts for up to 36 hours and is more suitable if you require treatment for a longer period of time, such as, for example, over a weekend. There are many other treatments for erectile dysfunction, including vacuum pumps, hormonal injections, and penile implants, which you can discuss with your GP. Often you need further referral to secondary care for these options. And that is a brief summary of erectile dysfunction. Hopefully that's given you a better insight into the topic. If you do have any questions or queries, please do ask in the comment section below. Thank you for listening. Take care.